Hi, I'm Dr. Christopher Bingham. I'll be in to meet with you soon, but first I wanted to take this opportunity to answer 5 common questions associated with periodontal disease. The first one being, what causes gum disease? Gum disease is caused by disease-causing bacteria that get stuck to the tooth down below the gum line. But not everyone who has this bacteria gets gum disease. Why? The reason is that not everyone's immune system responds to this bacteria. So those that have gum disease actually have an immune system that is a hyper-responder. If you have family members who have gum disease, you're going to be more likely to have gum disease as well. Second question, what are the goals of treatment for periodontal disease? The first one is to stop inflammation. Inflammation, when it persists, will actually destroy bone. Number 2, I want to shrink probing depths. By shrinking probing depths, it reduces the area that the disease-causing bacteria can inhabit. So if we reduce inflammation, which is the causing bone destruction, and we shrink the pockets, we then make it possible for health to return and for people to adequately clean their teeth. Number 3, what are the treatments for periodontal disease? Non-surgical treatment. My hygienist uses an endoscope. What that means is she has a small camera in one hand and an instrument in the other. This allows for her to see exactly where she needs to place the instrument to remove the disease-causing bacteria and to remove rock-hard tartar that's accumulated under the gum line. In addition, she also uses guided biofilm therapy, which is kind of like a pressure washer for teeth. It uses warm water and a vibrating mechanism to remove harder deposits that are on the teeth and inhibiting the body's immune system. What we found is when we use these things in conjunction, it has meant that our patients have needed surgery far less than what they did if we didn't use these instruments. The second treatment is surgical treatment. And that can either be a regenerative procedure or a resective procedure. And I'll explain exactly what that means. So gum disease has destroyed bone in an irregular fashion. My hand's representing the bone. As I'm probing, I know that the bone level is good on this site, but then when I slide down, it's this discrepancy that's caused the problem. Now the bacteria accumulate in this area, and when it accumulates, then that continues the bone destruction. So I have one of 2 options. I can either grow the bone back to the level that it was, or I have to adjust the bone level that's here and lower it. Most instances, I actually cannot grow the bone back, and so that leaves me with one option, where I actually have to adjust the bone level that is high and lower it down. What this means is that it's going to expose an area that was once under the gum to making it above the gum. You can kind of think of it as your teeth wearing a turtleneck, and now I've placed a t-shirt on. By doing this, we've removed the pockets where bacteria grow. Question number 4, what about lasers, mouthwashes, and special rinses? Some people ask about these. I don't use them in my office because the evidence to use them is actually not very strong. While they may not hurt, I don't know that there's going to be a significant benefit. And we only want to do the things that we know are going to benefit you. Now, what happens after treatment? This treatment can sometimes take a year or longer. And what is the most important thing to do on the back end of this is to be cleaning your teeth very well at home. This includes using a powered toothbrush. This includes using all the things to clean in between teeth, whether it be floss or small brushes. And the other thing is that we need to be seeing you every 3 months. Now, when I say eventually you're going to be alternating with your general dentist, but because you've invested so much in time, money, and energy, the best way to protect your investment is to have your teeth cleaned professionally every 3 months. And so as we move through the process and as we get to the end of the process, we're going to transfer you into this maintenance pool. Now, in some respects, this is the most important part because I've seen sometimes where patients go through the first 2 steps of treatment and then we fall off and aren't seen in maintenance, and then the disease comes back and now we've kind of lost ground and we have to start back at the beginning. So if you want to protect your investment, time, energy, and money, then maintaining things with a 3-month visit is best. Thanks for watching. I'll be in soon to meet you, to examine your gums, and to answer any additional questions. See you soon.